طيب، السلام عليكم جميعا. ومرحبا بكم في اجتماع تاني والزوم ميتينج. والليلة بقيادة أستاذة أريج وكوكبة من الإخوة والأخوات اللي هيتكلموا الليلة عن public health. فأول حاجة بنشكركم جميعا على المجهود الكبير في تنظيم الفعاليات دي. مدركين إنه الشغلة دي يعني بتاخذ زمن طويل جدا، فشاكرين لكم. ونتمنى إن شاء الله إنه الكوميونتي بتاعتنا تستفيد من الزوم ميتنج دي. هيكون في ريكوردينج، هيكون برضو موجود في كل وسائط بيت السودان، في الفيسبوك، في جروبات الواتساب، في كل الوسائط يعني. كتر خيركم وتفضل يا ريج.
Assalamu alaikum, everyone. My name is Edith. I want to thank everybody for coming out today on this Saturday, whether you are a participant or you're here to support. But special thanks definitely to our speakers, Dr. Muhammad Jibril and Shima Idris. We are really very, very lucky to have you guys here. You guys are a wealth of knowledge. I'm excited for the information you're going to share with us to introduce people to the field of public health, whether they're curious about it or they're in the field, and maybe you can help them navigate how they can improve within their career. So, welcome. Like I said, Dr. Muhammad Jibril is a PhD candidate at UNCG. He does a lot for our community. He really plays a big role in bringing outside resources for our community, whether it's through funding or opportunities. Shima Idris, based in Durham, is also our Sudanese pride. She works as a senior epidemiologist at the CDC. We're really proud of you, and we can't wait to hear about your experience and learn from the knowledge and the experience that you have to share with us. So, welcome everybody, and I'll let our speakers kind of introduce themselves, and we'll get started, inshallah.
You want to go first, Shema? Ladies first. So
All right, Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for that, Arij and Beta Sudan for letting us come here and talk about public health. My name is Shema Idris. I live in Durham, North Carolina. I'm originally from Kasala, Sudan. We moved here when I was very young, 3 years old. I went to high school, elementary school, everything in Raleigh and Durham, North Carolina. I went to NC State for college. I studied history and biology. And then after that, I moved to Baltimore City. I worked for 2 years at the Johns Hopkins Department of Epidemiology. And then I did my master's program also at Johns Hopkins. I studied epidemiology and biostatistics, and I've been working as an epidemiologist for 5 years. So that's a little bit of an overview about me. I'm happy to be here. I didn't know anything about epidemiology when I was in college. I didn't know anything about that much about public health. I thought I wanted to be a doctor, and alhamdulillah, Allah prevented me from being a doctor and guided me to public health because this is the right field for me. So I'm happy to share that to, Sudan House and the Sudanese youth because I definitely think we need more of us in public health, inshallah.
طيب السلام عليكم everyone. First of all, just thank you to Beta Sudan for hosting this session and soon to be Dr. Arij. So thank you so much for also inviting me to be one of the speakers today. My name is Muhammad Jibril, of course from Sudan, but I was born and raised in Saudi Arabia. Before coming to the US, I lived for a couple of years in Moscow, Russia, where I attended medical school. Came to the US, and I just knew that I did not want to do clinical medicine. So I'm also grateful that God has prevented me from continuing that path. So I went to Queen's University of Charlotte, and then went to Georgetown University School of Medicine, where I received a Master of Science degree in biohazardous threat agents and emerging infectious diseases. It's a very mouthful title for a degree, but essentially the focus of my education was on global health security and medical preparedness, response, and capacity to health threats in general. Right now, I'm a PhD candidate in public health with a concentration in community health education at the University of North Carolina, Greensboro, and I'm defending my dissertation proposal next week. So it's a very, very busy time for me, but I'm really excited to be here and to have this discussion.
Thank you guys for that lovely introduction. I also want to give an opportunity to Dr. Amani, the woman who makes this all possible, to introduce herself and give us a little word.
Hi everyone, how are you doing? I'm really glad to have all of you with us today. It's really interesting for me that today we're going to talk about epidemiology. Part of my PhD degree was in epidemiology, so it's really interesting field, including the public health. So really glad to have just people from our own community to speak about this topic today and how you could pursue a career in this path. Really glad to have all of you. Just a quick introduction about myself. I'm Mani Babikir. I work as the lead microbiologist in Ecolab, but also I'm honored to be in the board, executive board of the Sudan House as a secretary for women and children affairs. So really glad to have this chance. And thank you to Dr. Arid. Thank you for leading this. And thank you also to our presenters today. Thank you.
Thank you all. We're all lucky to have you as part of our community, mashallah. And we'll get started on our presentation.
Okay, inshallah, it does let me share the screen. It's been bugging me about settings since I started, but let me know if you guys
We do
can
see your screen actually, so.
I tried to actually share my screen and I couldn't. Shema, I'm sorry.
No, it's okay. Are you guys seeing the full screen?
So you have to click on slideshow.
It's on your upper right.
Yes.
There you go. Perfect. So,
Okay, so I think we can start with this slide. Just to give you guys, we give you guys a little bit of an overview, but what does the day-to-day look like in our careers? Like I said, my name is Shema. I have a biology and history degree in undergrad from NC State University, and I have my master's of public health and epidemiology and biostatistics from the Johns Hopkins Bloomberg School of Public Health. It was a one-year program. I worked there for 2 years in the Department of Epi on a hepatitis C and substance use project. And then after I graduated, it was 2020. So it was during the pandemic. So there's a whole bunch of epidemiology jobs that just opened up. And I took one at the Maryland Health Department and I worked there for 4 years. And now I'm at the CDC Foundation. So that's the Center for Disease Control Foundation as a senior epidemiologist. Like I said, when I was in undergrad, I thought I wanted to be a doctor. I didn't know much about grad school. My family is first generation immigrants. I didn't have anyone who went through the university or graduate school route when we were here. So I thought that the only way to serve Sudan and Sudanese women and Sudanese people, which is what I wanted to do, was to go to med school. And I did an internship. It's called Minority Health Intramural Research Training Internships. They're funded by the NIH. And if you are an undergrad, then you should definitely seek them out. They look for people who are minority researchers, basically. And I was a biology major. So I wanted to do research internationally. They put us in Lusaka, Zambia for about 3 months, and I worked at the Center for Infectious Disease Research. And when I was there, that was my first introduction to epidemiology. So we were looking at the high hepatitis C rates that were in the community at the time and their relationship with alcohol use. And there is a correlated relationship between definitely injection drug use, but also substance use and infectious diseases such as hepatitis C. And we did some shadowing, and that's when I realized that I would much rather work at like the population level rather than the clinical level, like work directly with patients. So I did that for 3 months. I came back, I finished my degree, and then that's when I applied for a research position at the Department of Epi on another hepatitis C project at Johns Hopkins. But that kind of experience is what shifted me into public health. Benefits, there's definitely benefits in terms of if you are not a clinical person, but you do want to serve people in terms of improving the population health of your community, you can see the everyday impacts of finding out the upstream, which we're going to talk about later, upstream or risk factors or social determinants that cause health and how they're easily preventable. And actually, as a society here, Sudan, everywhere, a lot of the tools to prevent the biggest diseases and the biggest disease burdens in countries, we already have, but it's a matter of like developing the right programs and getting the right funding and putting it into the right sources to prevent a lot of these treatable diseases and preventable diseases. So seeing that and being able to contribute to that, that's definitely a benefit of my career. Work-life balance, I would say, is a benefit. I'm an epi, I work 9 to 5, I have my weekends off, but when you get more into the senior levels, you can work more, like less hours some weeks, or dependent on what you're dealing with. So if you're dealing with COVID, it's definitely a stressful time period. But if you're just dealing with the day-to-day work at a health department, you have a little bit more of a balance in your life. What made you competitive for your graduate program? I would definitely say the research I did in undergrad. I think I did biology research and then also some field research. That's what they look for a lot of MPH programs, but also volunteer work, and then having a personal story about why you want to be in public health. And my day to day is pretty, 9 to 5. I go to work Monday to Friday, and then I still have time for family life, for my hobbies, for um, seeking knowledge outside. I also do volunteer epidemiology work for something called the Sudanese Researchers Foundation. So we're a group of Sudanese researchers from Sudan, Saudi, the United States, and different places. And we're looking at the impact of the war right now on higher education in Sudan. So I do different epidemiological projects outside of my job, but epi is transferable. So you could do epi work with a company, with a health department, or you could do your own epi work. So if there's something else you're interested in, you have the tools and you have the skills to be able to investigate that. So I think I'll hand it to Mohammed. That was a little long-winded, but that's my spiel.
No, this is actually really amazing. And by the way, for the people who are going to listen to this, this is my first time meeting Shema, and I'm really honored to be speaking with you today, and also just to recognize that we have amazing people in our Sudanese community. And I say this because Johns Hopkins has the best public health program in the world. So we have a Sudanese woman, young woman, graduating from one of the top universities or one of the top programs in the world. It's something that we should all celebrate and recognize. So I just wanted to say that. For me, as I mentioned, before coming to the University of North Carolina, Greensboro, I received my master's in emerging infectious diseases. And what's really interesting about my experience is the fact that I graduated with this degree in 2020, in the midst of the COVID-19 pandemic. So I always share with people that an emerging infectious disease has disrupted my education of emerging infectious diseases. It was a really wild time, and you can imagine the academic excitement when COVID became a thing. And when I say excitement, I really don't mean it in a positive sense, because there's nothing good about a pandemic, as we can all agree. But it was an opportunity for public health experts, global health experts, emerging infectious disease experts to reinforce what they have been talking about for a really long time. And that was warning the world that this is a possibility. We knew that a global health emergency at this scale was going to come. Uh, why? Because there are a lot of different factors that have contributed to this. The Earth has been experiencing real changes, right? Climate change is happening, deforestation, population growth and population dynamics, international travels, migration, trades, global economy. So all these things and different political and social factors that we examine as public health people, we knew that these things were going to contribute to a global health emergency like the COVID-19 pandemic. COVID is no longer a public health emergency of international concern. This designation has been removed. However, there is a possibility for another pandemic to happen in the future, and we should be prepared for that. During my time at Georgetown, I worked with the Georgetown Global Health Institute, and the main research that I was involved in was an epidemiological study with pediatric populations, specifically living in the Palestinian territories of Gaza and the West Bank. It was an immunogenicity study on a new vaccine against rotavirus. And even though I was really interested in the science that we were studying, I was more captivated by the social and political determinants that were shaping health outcomes in the region. And I think that was the moment when I knew that I wanted to do public health. Because again, with my medical background and biomedical education at Georgetown, I wanted that, how can I say it? Like, I wanted that strong social background, even though public health is very multi-sectoral, it's a very interdisciplinary degree. But the core of it is social science. And it was a really great fit for me. Again, as somebody who brings a medical and biomedical background. The benefits, as Shaima mentioned, like seeing the improvements in communities that you're serving and you're a part of is a great reward for us as public health practitioners and scientists. Maybe if I can mention something negative, because the question is about the not only the benefits but also the drawbacks. I think my focus right now is in community health education is definitely not regarded as high as epidemiology, for example, in terms of pay or work opportunities in general. Um, and the reason for me that I really wanted to do something community connected or community informed is because I had the realization that scientific knowledge alone is really not enough. This knowledge has to be or has to take into consideration the cultural context, right, of the community that we're working with. Um, like we really have to give the community ownership over their own health, and this community part was really important for me. What made me competitive for my graduate program? I think also my research experience during my undergraduate education and during my master's degree, but also showing the selection committee or the admission committee when I applied for a PhD that I knew what I was walking into, right? So by mentioning which professors that I wanted to work with and why I'm selecting those professors specifically, and mentioning how I can relate to the research and the work that they're doing. So showing the school or the program that you're applying to that you know exactly what this is about is something really important. What does my day look like now? I'm still a student. I'm spending a lot of time working on a dissertation and just reading a lot of different articles and analyzing data. So maybe Shema is better equipped to talk about the work life because again, I'm a full-time student right now. I think before we move to the other slide, I can mention because I'm also working part-time as an environmental public health program coordinator with an organization called Mobilize Green. And I'm mentioning my work with Mobilize Green because right now we are looking for interns. So if you are passionate about public health and environmental health specifically, please contact me because we have many positions. Mobilize Green is partnering with organizations all over the United States. We have in-person positions, we have virtual positions. I think the last time that I looked, we have over 50 positions that we're looking to hire students for. And I was really lucky to recruit some Sudanese students, specifically from the Sudan House, who are working with me right now on a variety of projects. So please just feel free to reach out and I can talk to you more about the work that we do with Mobilize Green.
Amazing. I'm also gonna throw a little plug in for a program at Johns Hopkins because their deadline is coming up. So it's January 1st. I don't know how many undergraduates we have on the call right now, but me and Mohammed's story is not unique. A lot of people start in basic science and medicine and then transition into public health. It's a very common trajectory. And if you did study a STEM discipline, even computer science or information systems or engineering, but especially if you study sciences, chemistry, biology, biochemistry, all of those, and you're interested in doing a research project at Johns Hopkins, they have something called the Student Internship Program, and they have about over 100 positions. And, I am on the committee, so I can't say too much about, but I'm just going to say, if I see a Sudanese applicant come through, I'm going to look at that real well and try to push it through. So if you want to apply and get a fully funded internship program at Hopkins doing basic science research, and then also probably a letter of recommendation from your supervisor, please, I'm going to put the link in the chat later, but they're called the Student Internship Programs, Basic Science, BSI, SIP. And the deadline is January 1st.
Yeah, for Mobilize Green, I do not have that
لو
kind of
سمحتوا
restriction.
معلش سوري to interrupt بليز اي زول ما بيتكلم بليز ميك شور يو ميوت اي زول ما بتكلم لو سمحت اعمل ميوت للمايك عشان نسمع شيماء واخونا محمد.
Zubair,
شيماء.
Rabab, I think all of
I'm
you are
able
unmuted.
to mute
I'm just
him.
Yeah,
calling names
please,
now.
can you mute people?
Shima,
Yeah,
Yeah,
I
thank
did.
you.
Is there anyone else besides Zubair?
you
Okay.
can mute Rabab as well. I think her mic is on, but she's not speaking, but just in case.
Okay.
Yeah, perfect.
No, what I was gonna say is that I don't have the same restriction as you, Shema, in terms of like the positions that we're hiring for at Mobilize Green. I am personally responsible for hiring 10 of those positions. So if I see your resume and it's compelling, I will hire you. So please reach out to me. Yeah.
And I think we'll put our emails in the chat later so people can
Yeah,
contact
we
us.
should definitely do that. Yeah. Okay, so what is public health? Let's do this a little bit of interactive. I was sharing earlier that I teach at the University of North Carolina. I teach courses in mental health and environmental health. So if you're in Greensboro and you attend UNCG, please maybe consider taking one of my classes. But anyway, I have the tendency of teaching, and I understand like this is not a classroom, but let's make this a little bit interactive. So for the people in the call, you're here because probably you're interested in going into public health. So what is public health? And I'm going to pause for a second to see if anyone wants to share, or even if you want to write it in the chat, that's fine. But if you unmute yourself and speak, that would be great. Yes, we will share the recording at the end of the session. So what is public health? How do you define public health in your own word? I'm not looking for any fancy or well-defined.
It's very broad, so there's very few wrong answers. Probably none.
Exactly. Yeah. Well, just to help you, there's actually no wide agreement on what public health is. So you can really share anything that you understand of public health. Um, no, nobody wants
So
to say anything?
I can go ahead.
Oh, awesome. Yeah.
I personally view public health as the first and basic step in keeping our population safe. Um, it's kind of that first line of defense rather than treating your diseases. You're just going to go ahead and prevent the diseases.
Awesome. Yes, exactly. So one of the main elements of public health, one of the main goals of public health is prevention. So public health is a prevention science. So if we go to the second slide, Shema. So as I mentioned, there's no wide agreement on what public health is. You know, like everyone is going to define it differently. If you ask someone with a strong background in health education versus someone with a strong background in epidemiology, they might give you different answers, but we all agree on three elements. The first element is that one of the goals of public health is to prevent diseases, as you mentioned, Hala. Thank you for that. The second element is promoting health, right? And lastly, is prolonging life within entire populations. Why? Because we do not work on that individual level, we work on a population level. So compared to clinicians who treat patients individually after they become sick, we as public health professionals, we examine the community as a whole because the entire community is our patient. Then we work to identify the root causes of health problems. And this is what Shema meant when she mentioned upstream thinking, right? We look at the root causes of health problems so we can eliminate them and implement larger scale solutions to promote health and prevent injury or illnesses. So before we move, Sheba, because we said we want to do this as a conversation, is there anything else that you want to share about what public health is from your own perspective?
I'll share a little blurb about in every intro to epidemiology class, you'll get the story of the father of epidemiology. I don't think he's the actual father. I think plenty of people were doing epi work before it was called epi work. But the story is that in the mid 1850s, there's a guy named John Snow, and it was the peak of the cholera epidemic, which is relevant now because there's a current cholera epidemic in Gaddafi state in Sudan. But in the 1850s, when this was occurring in I don't remember where, Germany, Britain, some country in Europe,
I think it's in
you,
England.
England, thank you. There was a pump that John Snow was able to realize that people who got water from this pump were the ones had the highest rates of cholera. So when the pump was removed, the cholera epidemic was eradicated in that area in England. So this is called like the origin story of epi. It's air quotes around that, but it's just a basic story about like what Hala was saying. It's the basic step, public health, which is a great definition, the basic step to prevent diseases from happening before it reaches to the point where you're treating a lot of cholera patients or you're treating people who have a lot of diseases. So
Yeah, I love storytelling as a way of explaining what public health is because the second slide, I also have a story to share there. It's not as cool as the story of Jon Snow, but it's a way for us to understand maybe the differences between medicine and public health and what upstream thinking is. So I always share this story. Actually, I have a video there, but I'm just going to share the story instead of listening to the video. If you see in this picture here, we have, as you can see, a river. And just imagine yourself, hanging out, just enjoying, like walking by the river, uh, in the downstream part of the river, right? Like in that part of the river. And then while you're there, all of a sudden, you see somebody drowning. What are you going to do? So hopefully you're going to try to rescue that person. So you go to the water, try to rescue that person. And once you rescue them, you notice there's a second person drowning. Then you go again to rescue that second person. Then you notice there's a third person. So you do the same, right? Then the fourth person and the fifth person. And then it becomes incredibly overwhelming. We have all these people drowning and you're trying to help them. And you have absolutely no idea where these people are coming from.
Mm.
So what you do next is probably take a step back and try to analyze the situation. Like, where are these people coming from, right? Like, why do we have a lot of people drowning? Then you know that this is the downstream part of the river, which means that probably these people are coming from the upstream. So you decide to walk upstream to see what the problem is. Like, why are people drowning and coming downstream? So when you go upstream, you see there's a bridge there, right, on the top of the river, but the bridge had collapsed for whatever reason. So when people are trying to cross the bridge, they end up falling into the water. So of course, the logical solution here is to fix the bridge. Once you fix the bridge, no more people are falling into the water.
Mm.
So this very simple story is literally telling us the work of public health professionals, right? We try to see what the root cause of the problem is to fix them. So when people or my students, when they ask me about the difference between medicine and public health, I always tell them that medicine is downstream thinking. You have patients who need treatment, right? They have a problem, you treat them. Public health is upstream thinking. You try to go up to the river, like the upstream part of the river, to see what the problem is and try to solve or address the problem at the root cause. There's a comment. Okay. Okay, and I have already evaluated my degree and help would be greatly appreciated. Definitely, we can talk about that later. Thank you for the question. So I hope this symbolic story helps define what the work that we try to do. So Shema, any comment, anything you want to add to this?
I thought that was a perfect analogy. So
Yeah,
yeah, mashallah.
perfect. That's the difference between upstream, downstream thinking. Awesome. And also, if any one of the participants have questions, so please just speak up, like unmute yourself and speak. Okay, so when we talk about public health, we also need to understand what health is, right? Because as a public health person, I think I have a different understanding of health compared to my time when I was in medical school or when I was studying, biomedicine or biology or, these basic sciences. So, and again, I mentioned my work with the Georgetown Global Health Institute on a study focused on immunogenicity in Palestine. And when I started thinking about the social and political implications of health, that was a really powerful or just very impactful time that really made me realize that, oh my goodness, like this is bigger than the narrow, thinking that I was having. So we have two ways of defining what health is. There's the biomedical understanding and there's the social understanding. Um, Actually, let me stop here for a second and pause the question. What is health? How do you define health? And I appreciate Hala earlier for talking about public health. So, how do you define health in your own word?
I'll go
Maybe
on.
maybe the well-being of the community, something like that.
This is a perfect answer. I did not expect I did not expect to have this answer, but yeah, absolutely. But I'm realizing the time. So when we think about health, usually we think about the absence of disease. This is what the biomedical understanding of health is, right? We think about disease processes, we think about disease causing agents, right? Whether it's a pathogen, environmental exposure, right? We think about what is causing the disease. We think about medical care, right? To treat. We usually have limited attention to socioeconomic and cultural determinants of health and illnesses. So this is how traditionally we have been thinking about health.
And Mohammed, don't worry about the time. If we have to go over, then we go over. People are genuinely
Okay,
interested in what you have to
awesome.
say, so don't worry about it.
Absolutely perfect. But in public health, we have a different understanding of health, which is the social understanding of health, right? Which focuses on social processes, including the social determinants of health. We think about the wellness model that I'm going to speak about in a few seconds, and also the social production of health and or illness outcomes, right? So we start thinking about what are the things in the society that are making us sick, right? So if we go to the other slide, unless Shema, you have something you want to add here too.
I think Isra put in a comment about health from the World Health Organization, and I do think this definition of health got updated recently because,
The
like
state of
Mohammed,
complete medical, mental, and social well-being.
Mhm.
Yes, it has definitely been updated. Yeah, because they also include the spiritual health. I think they added spiritual health and then they removed it for some political reasons. But anyway, like that is a good way of thinking about what health is because it's not just the biomedical processes. It's not about the disease causing agents. It's bigger than that. So with like in the courses that I teach, I always talk about the 8 dimensions of wellness. We cannot consider the person healthy if they don't have a disease, and that's it, right? If they have problems socially, if they do not have access to education, right? If the person is food insecure, for example, right? If the person does not have a job with a stable income, we cannot consider that person healthy, even if physically speaking, that person doesn't have any disease or illness, right? So we have to consider all these different dimensions: emotional health, spiritual health, intellectual health, physical health, environmental health, financial health, occupational health, and social health. I think this is the most comprehensive dimensions that I've seen of health. I don't know if you, Shema, have another dimension that probably is not mentioned here that we should be aware of. Yeah, so we have to think about all these different elements before we conclude like this person is healthy, right? It's about the well-being of the individual.
I just want to add a point here that you can in public health, you can work within any of these dimensions, right? So there's not just infectious disease epidemiology, even though it's the most well known. And I'm going to keep talking about epidemiology because that's my career. But keep in mind, public health is policy, it's law, it's medicine, it's government, it's environment, it's everything. So we have social epi work, physical epi work, environmental epi work, policy epi work, zoonotic diseases epi work, hospital related infections epi work. So there's in every single one of these dimensions, you can find a public health career but most of the time it's a crosstalk between all of them. But if you wanted to focus on a specific type, you could.
So Seamus, since you mentioned epidemiology, how do you define epidemiology as a specialized field within public health? Like epidemiology to me is the cornerstone of public health,
Right.
but it's different from the other, concentrations of public health.
Mhm. So I would define it in the most basic terms, the study of disease control, transmission, and prevention. So a lot of epi work is super important because we're the ones that quantify the disease load in a population and then kind of design the studies and contribute a lot to the design of studies and interventions to prevent diseases. So I think, yeah, that's a basic definition.
Yeah, exactly. And for me, as somebody who is specializing in community health education, we use epidemiology all the time, but the focus of my degree is a little bit different. The focus of the work that I do is on intervention design. Basically, that means if I see a health problem, what health programs can I create to stop this problem from continuing to happen? So
Right.
basically, it's an intervention or a way for us to, again, the word intervention is really key here because we're intervening to stop this health problem from continuing. For example, like my work right now focuses on HIV, specifically children living with HIV. And when you reach a certain age, then you have to transition from your pediatric care to adult-oriented care. And this time of transition is characterized by a lot of problems, right? Not everyone actually continues to go to the doctors after they stop after their pediatrician tells them that you need to, at this point, you need to see another doctor. It creates a lot of confusion, a lot of problems. So we have created an app. It's called iTransition, where we sign up, again, youth living with HIV and the pediatric clinic providers, as well as the adult clinic providers. So all these people can communicate at the same time. So this is an intervention. It's a way for us to address this problem. So yeah, I just wanted to mention this to show you that public health has different areas and fields within public health. We have to talk about the social determinants of health because this is the framework that's guiding the entire field of public health today. This is the public health paradigm. Social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risk. So again, think about all these different social determinants. Education, right? Those who receive education, they tend to present better health outcomes, right? Do you have access to healthcare? Do you have health insurance? This is a huge determinant. What about the neighborhood? The neighborhood where you're living, right? And the built environment around you. Do you have access to places where you can practice physical activity, right? Or do you live in a neighborhood that does not have access to healthy, nutritious food, right? And I say this because I myself lived in a food, like for a long time, I lived in a food desert community neighborhood when I was getting my undergraduate. I was a student. I did not have a job. I did not have, stable income. So I was living in a neighborhood that was not great, right? So the only places for food that I had access to was McDonald's, right? There were no grocery stores near me, right? And I was a young man, so I did not have a problem to take the bus and go get me healthy food. But think about a single mother who does not have a stable income, right? Who has kids, and she doesn't have access to grocery stores. So she had to take the bus, right? And can you imagine like all the thinking that has to go into that and carrying so many bags, right, in her hands? And this is, again, as Shema mentioned, a policy level. So if we don't have um, good public health policies that demand that every neighborhood should have access to healthy, nutritious food, then that neighborhood has a public health problem that we need to address. So think about the economic stability, the social and community context, right? We are social beings. Do we live in an environment where you can interact with other people, or are you isolated? So all these different social determinants that we have to consider because they contribute to health at the end of the day.
Beautiful. I also like the fact that Mohammed talked about built environment. So environmental factors are related to a lot of public health problems. And if you live in the United States, you know we live in an environment that's built around cars. It's not built around people. And this produces a lot of, or leads to the upstream factors causing a lot of public health problems. So looking at those environmental factors is a big part of any public health career.
Yeah, absolutely. And lastly, I also wanted to talk about the social ecological model or the socio-ecological model. It's a framework that we use in public health to examine health burdens in general. So I talked about this single mother, right, who lives in a community that is considered food like a food desert community because she does not have access to healthy, nutritious food. That single mother has diabetes and hypertension because of, there's no access to healthy food again. So that caused diabetes, hypertension, right? You can think about a wide range of chronic diseases. We cannot blame the individual. We can't blame that single mother by saying that you did not eat healthy food. You do not eat healthy food. You caused this to yourself, right? We can't do that. Why? Because we have to consider the community factors. We have to consider the organizational factors. We have to consider the policy factors. So that's why it's called the social ecological model, because we have to examine that health problem from every single level and from every single angle. What are the individual factors? What are the interpersonal factors, right? Again, the community did not have healthy grocery stores, right? The organizational level. So this is where the place of your work or maybe the place of your education, like a university is considered an organizational level, or your place of work, as I mentioned. So if you study in a university that does not provide healthy food options, that's a problem, right? That we should be aware of. And also the policy, which is the structural level. What is the government, not only the local government, but also what the federal government is doing about this problem? So I wanted to mention this because, again, when we think about health, we have to think about health from the dimensions of wellness that I mentioned, all those different factors. We should also consider the social determinants in our society, but also we should examine the different levels of the society and how they're contributing to health. And I believe this is the last slide that I have. I had to mention equality versus equity, because we in public health we have a very strong emphasis on equity, right? So equality is great, but it does not solve all the problems, right? So we have those three individuals, right? They want to watch the game. There's a fence there that's preventing them. Giving everyone equal access doesn't ensure that everyone will have the chance to see the game, right? So equality in this case is not going to solve the problem. Equity, on the other hand, means that we have to treat every person individually, because people have different places and different points or starting points in life, right? Not everyone needs the same treatment. We have somebody who we have a child, right? Like one box is not going to be enough for that person. So in public health, we have a very strong emphasis on equity and giving every community the needs, right? And in my field of community health education, we still use traditional quantitative, qualitative methodologies, but we use something called community engaged participatory research. And this means that we go to the community instead of just having a survey with questions, right? Collecting data from communities. I go to the community and I ask them what questions we should ask in the first place, right? They should drive our research. And because they know the problem, they're living it. They know it better than us as researchers, right? So sometimes, especially like people with PhD who engage in research, they always go to communities with with kind of authority, right? They treat communities with an authority, like I am the expert, I know what's going on, right? In public health, we try to go away from that and let the community actually drive the change that they want to see.
Mhm. Thank you, Mohammed, for saying that, because I think that's actually a really important point. A lot of times when we do go and just focus on the end point or the outcome where someone has a disease and need to be treated, you end up getting individual blames or there's individual actions that are responsible for that disease. And public health helps mitigate it or take it to a broader zone where we could look at the broader upstream factors leading to it. But I want to talk about the community impact. This is something I will also talk about as a struggle within public health, because it is supposed to be focused on equity, and it is supposed to be focused on individuals in the community kind of leading the way in terms of what are the public health problems, or what are the topics that we should focus our funding and focus our research and focus our interventions on. But when I was in grad school, sometimes the funding kind of dictates where you do your research and what you want to do, because my main objective was, I'm a Sudanese woman. I want to serve Sudanese women. So what in public health, what kind of epi research projects can I do? And I took a job at, or internship for an organization called Rahma, which is Reaching All HIV Positive Muslim Americans. It's a grassroots based in DC. And there's a reason that there is there's a lot of HIV funding in the United States, especially because of the 80s and 90s, the epidemic, and then there was a lot of funding sources that led into it, which is great. But if I am looking to do funding to like do a community health assessment among Sudanese women in Greensboro, North Carolina, masalan, I'll run into issues where the projects that I find, they're going to be objectives that maybe the Department of Health and Human Services finds interesting, because further up, you got the US government is interested in it. So all I could find was FGMC work. It was like, I'm a Sudanese woman, I want to serve Sudanese women. And they'd be like, oh, we have a project for you. And if you don't know what FGMC is, it's female genital mutilation / cutting, which respectfully could be an issue in its own right. But I've grown up in my Sudanese community, and that's not what we talk about. Like, that's not what we're identifying as the problems that we want to talk about. But it is of use to the US government and its kind of imperial objectives. So you have these sources of funding that come from projects that are more of interest because of policy and law and maybe military goals, objectives that that come down into public health. So if you are someone who is in public health and you want to serve your community right, it's really important that there are people like Mohammed, and there are people who are doing something called community health education and community health work. And we have positions within public health, like community health workers, that actually make sure that it's brought down to the level of the community and the community is guiding this work. But there are institutions like Hopkins, like a lot of the big funded institutions that actually respond to colonial funding or where the money goes because of higher objectives. So this is, public health operates in a world that it is not equitable. And that's why that even though we can say and we want to pursue equity within public health, it is up to the job of people within public health to make sure that that is happening and it doesn't get sidetracked by outside objectives that don't serve our community.
I really love what you just shared, Shema, because, and I was afraid to say this earlier, but I guess I'm going to say it.
Say it.
We deal with a lot of white supremacy and racism in public health because we rely on funding from the US government. And the US government is not going to fund any work that's not considered a priority for them, right?
Right.
So when I said earlier, like one of the negative aspects of specializing in community health specifically within public health is pay and salary, like compared to other areas of public health. Why? Because it goes back to what science is and what knowledge is, right? So when I talk about community engaged participatory research or even qualitative methodology,
Mhm.
to a lot of people who are sitting in those big funding institutions like the NIH, which is probably not probably, which is primarily made up of like over 90% white, wealthy, old men
Yep.
who have a specific definition of what science and what research is,
Mhm.
then you present, right, a proposal that is um, qualitative in its nature. That's not a research. It's not fundable, right? So that's why, like, you're gonna find a lot of privilege in epidemiology, right? Because it's inherently quantitative. It aligns with the definition of scientific inquiry, right? So uh, it's really important for, and again, like there's a lot of movements in public health for decolonization, like to decolonize global health and decolonize public health in the United States. And there's a lot of different movements right now happening to push us to think about public health a little bit differently.
Right.
And again, like right now with the Trump's presidency, probably the priority shifts of what research is going to be fundable. It's really going to change, right? We're going to see that the funding is going to go to specific places that align with the U.S. government, and so we should also be mindful of the political landscape. And again, it's called public health, so it's always going to be political. Public health is political, so we should not shy away from speaking about politics in public health.
Absolutely not. And we definitely need more Sudanese people and more of us in general within the public health domain, making noise, shaking up these systems and getting the skills to be able to do the projects and the interventions and push for the policy that we know our community needs and can benefit from.
And I also want to mention, Shema, that I actually just came back from Minnesota. I attended the American Public Health Association annual meeting, and there was a huge session focused on Palestinian health during like right now as Palestine is going through a genocide. There was absolutely zero mention of Sudan, no mention of Sudan's health at all, or Sudanese health. You mentioned the cholera outbreak. I don't think it's in Gaddafi, just in Gaddafi. It's all over Sudan. There is a
Right.
dengue outbreak, or humadanak for people who are not familiar with the terminology. Um, Sudan is going through a genocide right now, right? And these big, huge public health institutions is not even talking about it. And I don't even blame them. I don't blame them because we're not doing anything about it. Like we as Sudanese people are not pushing those organizations to do something about it. So again, as Shayma mentioned, we really need to see like more Sudanese people. I reached out to the chair of the Peace Caucus of the American Public Health Association. So I have meetings with them in the coming weeks, and I would love for you, Shayma, to be a part of those conversations.
There. Yeah,
Yeah, to include Sudan in the 2025 American Public Health Association annual meeting.
as it should be. Amazing. Thank you, Mohammed, for that.
Awesome. Thank you guys so much. This was an amazing presentation. I really appreciate all the information, but definitely like your transparency through all of this. I think that really something that we all appreciated. I always say it takes a really special person to be in public health. You really have to have a deep commitment to help people, and we definitely see that in both of you guys. I especially admire the fact that you guys want to uplift our community and really center Sudan in a lot of your work. So, Jazakumullah khair, and inshallah, this is just the beginning. Starts with this, you guys meeting each other, collaborating. And like you said, offering those job opportunities to both of you, to everybody on this call. So definitely jump on that opportunity, mashallah. And if there are any more questions from the audience, we can go ahead and take them. And I know we have a lot of people here who are more either in the public health, post-grad, considering public health. So go ahead and ask your questions. These are going to be great resources for you, and they're more than willing to answer your questions.
Can you go to the previous slide because I just included like about 15 different career pathway within public health, and this is not a limited, this is not everything. There's more than this. So I just wanted everyone to see the different paths that people can take. And I also want to point one thing. I'm doing my PhD in public health. Shema has her Master's of Public Health. And I really don't see a PhD and MPH as one is higher than the other. I think in public health, probably public health is the only area of study where I see a PhD and MPH as just a completely different paths. This is not higher than the other. And I say this because a PhD is research intensive, while MPH is a practice intensive, or practice based. That doesn't mean MPH people do not engage in research, and also it doesn't mean that PhD people do not engage in practice work. I think practice informs research and research informs practice, but it's just two different ways of addressing public health issues. So I just wanted to mention that for those of you who are considering a higher degree in public health.
I'll throw in there. I think that was a really great overview, Mohammed. There is actually a degree also called a Doctorate of Public Health,
Yeah,
or
yeah.
RPH, which is different than a PhD and it's different than an MPH. It's more of a
Leadership, I think,
leadership.
focused.
So if you want to be in more of a leadership position, kind of leading some of these public health organizations, it covers a wide array. They tend to be a little bit more flexible than maybe a PhD. You can do it part-time. You can work while you're studying for a DRPH. They're not available at every academic institution that has an MPH or PhD option, only a few. But that's also an option for people who are looking to be in more leadership positions in public health.
And if there's anyone on the call too who's interested in more like clinical healthcare fields, like an MPH or a PhD even in public health will be like make you more competitive for those programs. So just something to be mindful of. Whenever you're applying to these programs, they do appreciate someone coming from a public health background. And I think it definitely makes you a better provider too, more empathetic, knowing those social determinants of health and understanding why that patient is sitting there in that chair. I certainly deal with that every day. So you can't go wrong with public health, essentially. So
Right. I'll
I
add
have
that.
a question.
oh yeah, sorry, Amani.
I have my daughter sitting with me, listening to the presentations. So one of her question is if there is any undergrad degree that could get me to the public health. I gave her some options, but I want to listen from you. What options she need to go to for the undergrad?
Yeah, absolutely. I mean, UNCG has a bachelor degree in public health, and we have two concentrations for the public health bachelor degree. We have a concentration in health education and in health sciences. So having a degree in public health with a concentration in health sciences, this is designed for students who want to have a background in public health, but also they want to go to medical school or dental school, exactly what Arij was explaining. So it's a really great bachelor degree for those who want to go to uh, a clinical degree. So yeah, there are a lot of different public health bachelor degrees,
Yeah.
not just at UNCG. I'm pretty sure all over.
Yeah, UNC Chapel Hill also had something similar. So I did my bachelor's was a Bachelor of Science in Public Health from UNC Chapel Hill. And for a bachelor's, we had four different routes. You could do biostatistics. So if you wanted to go more of the epidemiology route or just wanted some sort of experience in that. We had environmental health, we had health policy and management, and we also had nutrition. And that's the concentration I chose. That one was similar to the one Mohammed is describing. It's more tailored to people who want to go medical school, dental school. I think 90% of those individuals ended up going to medical school. So a lot of the classes, the nutrition classes, are really biochemistry classes. But in addition to that, we were taking health and human behavior, we're taking epidemiology, we were taking biostats classes. So we got a good foundation in public health in addition to those biochemistry classes. And that's something I think when I was applying to the dental school, a lot of people appreciated. A lot of the people who are applying to medical and dental schools, they were biology majors, but public health does set you apart. So,
Great. Thank you very much.
Yeah, thank you. Thank you for the presentation. Well done. Um, Very informative. So one of the question I want to ask is about the salary range for like position on the public health arena. But before we do that, I want to give a seal opportunity to ask a question. I think a lot of people are raising their hand. So let's do that first, and then you could answer the question later. Thank you. تفضل يا سيل.
Yes, thank you. My question is, I actually did start an MPH in Sudan, but my education was interrupted. I wouldn't say interrupted, but we're going very slow. Like I was supposed to graduate in June, and now I'm looking at one more year, like maybe next June. And and it's been very hard navigating because like I can't even get my transcripts from my university to like apply somewhere else. So my question is, for someone who's stuck in such a position like me, what skills can I pick up by my own to like try to enter the job market or get something like entry level or anything of that sort?
Asil, I have an opportunity for you. I'm gonna share with you my email, and I don't know if you were here when I talked about the organization that I'm working with. It's called Mobilize Green, and we are looking for public health interns for the next semester, for the spring semester, and we are recruiting right now. So I will share with you my email. So please email me, and I will share with you the application. And I would really, really, really love to have to have an application from you.
That's awesome. And is this job virtual or is it in person, Hamid?
We have in-person positions and we have virtual positions. So we can talk, Asil, more about your background, what your interests are. I'm not sure where you're located, but again, like Mobilize Green is a national organization. We have partners all over the United States. Um, we have virtual internships, so we have a lot of options. So let's just have a conversation.
That's awesome. Jazakallah khair.
I
And try to share with everybody who's on the call as well. So whoever's on the call,
Yes.
you can put your email address in the chat, and then Mohammed, you can share that information, and I can shoot those emails to them. And
Yeah,
then
perfect. So I'll send you an email with all the information, and you can just share it with
okay,
everyone.
perfect. And I'll also share these people's email addresses with you just in case you need to reach out to them about anything.
So I know, Khalid, you asked about the salary range for career in public health. Uh, it's a very difficult question to answer because it depends on what pathway you take. For me specifically, I'm doing a PhD because I want to teach. I'm actually right now I'm on the job market. I'm interviewing for assistant professor positions. So for professors, it's very, very different from people working um, again with the government. So Shema works for the CDC. It's uh, the main public health agency of the United States. So that's going to be completely different. If you're working on the local government, again, are you epidemiologist? Are you going to be a public health policy analyst? I think most of the money it's going to be in epidemiology, public health policy, and I think biostatistics. Um, and we're talking about like over 100,000 a year.
So is the private sector more competitive? Would you agree with that than the academia? I'm trying to get a ballpark estimate, like whether the private sector is more competitive or the academic route, maybe.
Shema, do you want to take on that?
I think it really differs because there's so many different public health agencies that work both private and public. So public sector jobs like federal jobs, state jobs, local and government jobs, they'll offer the most stability, they'll offer the best benefits. You can extend your whole career to be in those types of organizations, and it's with time. So I'm pretty transparent about what an epi salary looks like. If you work for an academic institution, مثلا UNC, NC State, Johns Hopkins, you're not going to make as much as someone who works for a federal job like the CDC or the Center for Medicaid Services. You might make within the first 1 to 5 years out of your master's degree as an epidemiologist, you'll make around 50 to 70K. Once you hit past 5 years of experience, whether that be at a local government or academic job, that's when you usually start to make more than 6 figures in regardless of the sector, private, public. EPIs tend to get higher paid when they have more experience. So once you hit that 5-year post entry level EPI job, you can make 6 figures or more. The most highest paying jobs tend to be jobs at federal agencies like the CDC, but also nonprofits. So I want to clarify, I work for the CDC Foundation, which is a nonprofit that contracts out epidemiologists to local and state government organizations. So I'm in person at the North Carolina Department of Health. And that's a pretty well-paying job. So a nonprofit like the CDC Foundation, it'll pay more than if I just took a job at the North Carolina Department of Health. It'll probably be around 60 to 70K, but because I work for a nonprofit, you hit the post 6 figures salary. So it really depends on where you're stationed. I would definitely say you can make a good salary, provide for your family after you hit 5 years, and then you'll also have a stable job if you work within epidemiology, biostatistics, even health policy and management majors. They tend to also make a lot of money post graduation, as well as healthcare administration or anyone who works on informatics or IT. That's also really big within public health. So you can enter that domain too in public health. So yeah, you can make a pretty lucrative career. I think consulting might be the highest paid. That's when you start to see people hit post 250K when you have your own individual skills and you can be a public health consultant. So yeah, there's a range and it really depends on where you are.
Thank you. That was very helpful. Thank you.
No problem.
And I think also it differs from state to state. So for those of you who are going to be applying for Mobilize Green, because Mobilize Green is based in Washington, D.C., the pay reflects that. It's again, because and I think we pay our interns well. I'm just going to say that. So just to encourage everyone to apply. If you're a graduate student, we pay you $1,000 a week. If you are in undergraduate, I think it's about $800 a week or something like that. So it's a living wage, especially for students. So yeah.
Can you guys speak a little bit about how to make yourself stand out during those interview processes and job applications, other than, your grades and research projects? So what can MPH students do, or, students who are currently in grad school, what kind of things can they do to really make themselves stand out for that interview process?
So do you mean the job interview? So after you got your MPH, or if you're looking for jobs post MPH, how to stand out?
How to make yourself stand out during those interviews. So what can you do during your grad school applications, or sorry, what can you do during your grad school education to make yourself stand out post-graduation?
That's a great question. I'll take it first, and then Hamid, if you want to add something. So practicum experiences or field experiences, if you're doing any MPH degree, you're going to be required to do a practicum. So you're to be in the field or do a project outside of your institution, somewhere working in the field of public health that you're studying. So for example, I took a practicum opportunity at the Baltimore City Health Department. And then I did a field project with tuberculosis in Dharamsala, India. So those were short-term projects. Well, actually, the Baltimore City one was about 4 months, but the field research was about a month. And doing those types and then being able to explain it, and then also having like the results laid out and maybe a presentation experience or a report writing experience, something where you saw a public health project from beginning to end. So you joined it, you had the concept map, you knew the study design, you did some type of implementation, so implemented the assessment or the survey, you did some type of analysis, so you broke down the results that you did get when you were in the field, and then you were able to present it or publish it in any capacity. So kind of from beginning to end, seeing a public health problem and joining in on a project and watching that happen and demonstrating that you kind of understand that, the public health process and have expertise in that dimension. So I would definitely say practicum experiences. Most MPHs are also capstone based. So being able to write your capstone, and then also I would definitely recommend anyone who does a capstone to try to get it published or seek out presentation opportunities. Mohammed mentioned the annual public health annual meeting, so the APHA conference, but there's plenty of conferences where you can apply, submit an abstract, even get reimbursement or funding to travel and present. So presentations, practicum experiences, and your personal story is super important. So why did you get into public health? What guides you? What happens when you might take a low-paying job after you graduate? What is still going to guide you? What do you want to do? What's the legacy you want to leave within public health? So those three things I think are super important. Personal story, practicum, and then presentation or publications.
Thank you so much.
Yeah. Yeah, for me, because I don't have an MPH, I had a Master of Science degree, but I can speak about the academic part for how to stand out. In academia, I think the biggest thing is publication, especially like first author publication is something really important, but also a lot of academic institutions want to see that you have a teaching experience. So I'm really lucky that I'm at UNCG because actually our program is one of very few programs in the nation where we as PhD students are required to teach. Like this is something that you don't see in a lot of programs. So having that teaching experience has been really powerful for me. And also just having experiences outside of school, like doing work in the community. One of the biggest honors of my life, like after graduating from Georgetown, I was selected by the United Nations for the Youth for Biosecurity Fellowship, which was organized by the United Nations Office of Disarmament Affairs and the Implementation Support Unit of the Biological Weapons Convention. So I spent some times in Geneva doing policy work and just studying the intersection of international policy, public health, and biosecurity. So that kind of work it definitely makes the person stand out when you do stuff outside of academia. And I'm speaking specifically if you're applying for academic positions. They want to see that you have some work outside of academia that you can bring to the classroom. How many of you wants to become a professor is here? I don't see a lot of people who wants to teach. People don't like to do that for some reason.
Muhammad, I mean, that's to some extent, I'm actually exploring teaching. I don't have a PhD, but I have an MBA. So that's something that I'm exploring.
Absolutely, yes.
I think that the key thing is to have passion about it. That's the key thing.
Yeah, and you can teach with a master's degree. You can definitely teach, especially if you're teaching a professional degree. If you're not doing, if it's not a research intensive area. I mean, even in public health, I have a lot of professors who have their MPH. They're professional professors. They're not tenure track professors. To be a tenure track, you have to have your PhD because you will be required to do research during your time as a professor. But yeah, anyone with a master's level degree you can teach. And also like for you, Arij, because you're gonna have a professional doctorate degree, you can also teach in any institution. We have some doctors
That's
teaching.
I didn't know that because I thought about it. Maybe in the
Yeah.
Speaking of the teaching aspect, Mohammed, best of luck. And what Mohammed delivered for you guys earlier, which is like the overview of public health, that was a quality public health like introduction. I would definitely like that's something we get in our first intro to public health class in the master's program at Johns Hopkins. You know what I mean? So it's good to be able to see it and know exactly what you're getting into before committing to an MPH program or know what the trajectory looks like after you do an MPH. So that beginning part, the dimensions, the sociological model, that's all crucial, important information to know if you want to consider doing a master's or a doctorate degree in public health.
I'm practicing my teaching skills. I'm trying. Thank you.
So these were questions that I think got submitted with the form where we did this presentation. If there are no more questions from the chat, we can, I think, briefly go over these. Any more questions from anybody? It's super informal, so anything you want to ask about a public health career.
I didn't even see that question about the difference between a master and PhD, and I already talked about it. So that's good.
Yeah, so we covered that one. We covered several of these. I think the diversity of the workforce one, do you want to talk about that, Mohammed? That's a crucial one to know about.
Yeah, I mean, also it depends. It depends on what kind of work you want to do. Um, it, for academia, specifically, like we always say that public health is different and public health doesn't have the problems that other fields have, but I don't agree with that perspective. I think we still have some issues with public health, even in academia.
Yeah.
Not even in academia, especially in academia. For example, like right now, I'm the only um, black man students in my department. They're black women getting their PhD in public health. When I was at Georgetown, and this is the reason why I chose to come to UNCG, even though Georgetown University is a globally minded institution. They do work all over the world. And I thought this is going to be the most diverse campus I've ever been to. That was not the case, especially in my program. I was the only Black person in my entire department. I was one of two international students. The other one is from Canada. So I used to tell her that I'm the only international person here. I don't even see you as an international student. So it's a real issue. I went to a community college in America. I went to a private institution, Queen's University of Charlotte. Then I went to a big private institution like Georgetown. And right now I'm in a public university, UNCG, and I've never been taught by a Black man. I know Black men professors exist. Like I have Black men professors, friends, right? They do. There are a lot of them. But in my own experience, even though I've seen every single type of higher institution, I've never been taught by a Black man. And to me, like I feel a burden. Like this is actually a part of the reason why I want to go into academia because representation matter. I would have loved to see a professor who looked like me. So it is an issue in academia that I'm navigating right now. So again, I talk about academia because these are the spaces that I'm navigating, but I'm not sure if Shaima has, of
No,
course, a different experience.
No, very similar experience, especially in my time in academia. So I had worked at Hopkins for 2 years, and then when I did my master's degree, it's definitely a white male dominated space. It's not even just the lack of diversity in people. There's also a lack of diversity in thoughts and ideas and funding and projects. So, like I mentioned earlier, I wanted to do something specific to Sudanese women, and I was very limited in what I could do, and it wasn't even a topic that I necessarily thought, my full life being a Sudanese woman in the community of Sudanese women that we talked about or we identified as like a major issue. But those were the only projects that were available to me. And then within my cohort, my MPH cohort, it was actually the most diverse cohort I've ever been in. So it's about 250 students. 50% of them are international students. So there's people from all over. And then within the domestic students, so those of us that were coming from the United States, it was white dominated, but we had a Muslim Student Association and everything, and a African Student Union and a Black Student Association. Like we had our groups that we can hang out with, but it still was a white male dominated space, and it's still like a colonial legacy institution. So what that means is sometimes you're not just representing your whole community, but you're seen as like an object to be studied yourself. So they don't see you as like a necessarily a professional or someone who isn't an expert in your own experience in your own community and your own issues. They see you as someone to be on the receiving end of whatever they have to deliver. So that savior complex in public health, it is there, it is alive and well. I definitely think that, us being in these fields and like advocating for our own communities and doing projects that we think matter makes a big difference when you join the workforce of public health. So I dealt with those issues in academia, and then early on as an epidemiologist. The further along you get into your career, I noticed you can pick and choose, the institutions you join, the organizations you want to be around, the people who get to benefit from your skills and your expertise, you can be a lot more picky. So now I work for, I mentioned that I do free epi work for Sudanese Researchers Foundation. So we're actually Sudanese researchers who talk about topics that are actually relevant, that we design, and we see the study from beginning to end and what our objectives of, and we're all kind of on the same page. And that's been really beneficial for me because I also love the fact that we're diverse as a Sudanese diaspora. So being the one Sudanese person in a space, or being Sudanese American and not even like fully like a Sudanese international student, you don't get to see the diversity of us as Sudanese people. And mashallah, we are talented, we're brilliant, we bring diverse experiences, we have our own ideas. And I really think we have all the tools we need to do better for our community and for Baladna, inshallah. So it becomes less of an issue in terms of later on in your career, you can pick and choose your organizations. If you don't like your supervisor, you think they're a little racist or biased, you can leave and go somewhere else, and you'll always find a job because EPIs are in high demand. But earlier on, you do have to kind of suffer. We all suffered. I definitely suffered, but it's why we need more of us in this field.
Yeah, please don't let the lack of diversity or our own experiences to prevent you from pursuing, this field. We need you. We really, really need you. And I think Sudan needs us. What's happening in Sudan right now is a public health crisis. And I want to see more Sudanese people talking about that. So we're depending on you. Absolutely.
100%.
Thank you so much for the thorough answer. That's actually a question I threw in there, and I kind of always throw it in there for the speakers. Okay. Yeah, just because I think it's really important for people who are going into the field to be aware of it. Unfortunately, that's the thing with all healthcare fields. It is older white men dominated, but it's important for us to also see you guys here in these, big shoes that you wear and those roles that you wear, or play. Because, when you see someone who looks like you're more inspired. You have this sense that, okay, like someone looks like me has done this before, so I can also do it. And, part of the reason too for me to create this series of webinars is representation, but also just to connect people. Like Sudanese people are doing amazing things, like you guys have said. We're in all kinds of fields. We just need to be connected for us to know that we exist and we have a passion. Like I say, the thing about Sudanese people compared to other communities, we have a passion for helping each other. And I don't know a single Sudanese person who doesn't want to help another person. So I just wanted to create this platform for people from, different walks of their life who are interested in learning about more of the healthcare fields, that to know that there are Sudanese people doing that kind of work, for them to learn from them, for them to receive mentorship. And, when I started was to target the youth, but really it's kind of grown from just the youth in our Greensboro community, more also people. We have people here who are not even from Greensboro, or even North Carolina. They're from different states. They're post-grad students. So alhamdulillah, I'm really grateful for how this has grown and for that impact to continue to grow. But it wouldn't be possible without you guys, Hamad and Shima. This was an amazing, amazing presentation. Thank you so much. So I, we were here for an hour and a half and we didn't even feel the time. So I thought it was very informative. It was very outstanding. Jazakumullah khair, inshallah. Does anyone have any more questions? And if not, I'll, pass the mic on to Dr. Amani and Dr. Khalid to do our closing remarks.
Hi, this is Amani. Can you hear me?
Yes.
Hello. Yeah. I just would like to thank Shima and Muhammad. It's really great information and very entertaining information about public health, and very beneficial. I know a lot of our kids and also even the adults, they will benefit from this information. And thank you, Dr. Reach, for driving this, and we are looking for more. So just thank you very much. I'm really proud of all of you. Thank you.
تمام. طيب yeah, so I want to echo what Amani said and really give my appreciation for everybody who was part of this event. Thought it was very informative, and I think those kind of events are more of a transformation event. Those calls, when we get into, we learn more, we get a lot of information. We grow as an individual and more as a community. So I hope that everybody enjoyed that. And I hope we continue this series. You know, you do it in a Zoom meeting, you have more flexibility to attend, so you get more value. Again, thank you very much, everyone, for your time, and very really appreciative of this effort. Thank you all.
Thank you. In our next session, before we close out, actually, our next session is going to be on physician assistants. That's going to be on the 23rd, so that's actually on Saturday. And then we have a session on medicine on December 7th. And then December 14th, we'll do dentistry and dental hygiene. So that'll be led by myself and another individual. And then inshallah, more sessions. I'm open to ideas. So if you ever have an idea for more, online program we can do just to benefit ourselves, but also the community, I'm more than happy to.
Can I just say this because I know people are going to be watching the recording later. I put it in the chat, but if you need a review of any of your MPH, if you're considering an MPH and you're applying this cycle, next cycle, you want a review of your application materials, or you just want recommendations on programs or jobs or concentrations and practicums, degrees, anything, feel free to email me. I will always help anyone who's Sudanese and looking to get in public health, or even non-Sudanese, but looking to get in public health. I put my email in the chat. It's sidries1@alumni.jh.edu, SIDRIES1@alumni.jh.edu. There is a scholarship called the Peter Salama Scholarship for Sudanese people who have to leave Sudan or are trying to leave Sudan and want to do a fully funded MPH at Johns Hopkins Bloomberg School of Public Health. The deadline is December 1st. So if you're interested in that, please contact me, inshallah. Jazakallah khair again, Shabab House, and everyone for having this.
Thank you so much, Seema. And I'll share both your email and Mohammed's with everybody who put their email address in the chat, inshallah. Perfect. Assalam.
Assalama. Thank you.
Assalamu everyone. Thank you.